Okay, good afternoon. Thank you very much, Erica. Today, I thought I'll present you with an even prettier face. Therefore, I've invited my research partner, Associate Professor Susie Costello, to join me with the presentation. So thank you very much for being here. Today, throughout all the talks so far, I felt that we've touched upon a lot of aspects that talked about the deficiencies of being an interpreter. We don't have the system to help us to perform well, the deficiency of ourselves, not understanding the context of family violence, the deficiency of the structural issues that Olga talked about overall, so that we are unable to perform to our full potential. Therefore, I thought for Susie and myself, for our talk today, this afternoon, I want to focus on you and yourselves. Why? Because you do matter. I'm sure again, for all the talks today, you do feel that we care so much about you. The industry cares about you. Training organizations, NAATI, professional organizations, we and they all value you. Therefore, for today's talk, we want to concentrate on you. So from Susie and myself. Maybe just a very quick quote from a paper that my colleagues and I did 3 years ago. Very quickly, these are true quotes from a couple interpreters, and I'm sure a lot of you have experienced something very similar. And probably a lot, and apologize if it's a little bit traumatic. So one of the interpreters said to us, I felt physically sick when interpreted for an incest case in a police interview. Another interpreter said, I stepped out of the police station after a long session of interpreting for a murder suspect who was still covered in the victim's blood. The police officers may well go for a counseling session. Where do I go? I still have to go home and then join the family for dinner as if nothing had happened. Okay, so that's very powerful and experience, I'm sure, like I say, a lot of you have had before. For the definition of vicarious trauma, Judy, you put me to shame because I couldn't do better than you. Therefore, I think I'm gonna skip it because you've done it already. Suffice to say, maybe just one point. I wanted to talk about this word, vicarious trauma, this vicarious word. 3-4 years ago, when I started researching in this area, honestly, I didn't even understand the word. So the first thing I did was I went to the dictionary to see what exactly the word meant. So basically, when we talk about vicarious feeling, it is a feeling that you, by watching, listening to, or reading about other people's experiences. So in other words, rather than you yourselves having the real experience, you listen to someone else, you watch, and then you kind of get the experience yourself, okay? So that's, if you go to those dictionaries, you will see the definitions. For counselors, to be honest, vicarious trauma, it arose from research in the counseling area. So say, for example, American Counseling Association had this very accessible definition, if you like, the emotional residue of exposure that counselors have from working with people who tell their trauma stories and from witnessing the pain, fear, and terror that trauma survivors have endured. And please take note, that underlined bit of counselors, if you swap it for interpreters, it just works just as well, okay? So we just have to pay attention to what we might be exposed to or what might happen to us as interpreters. Okay, so just very quickly, I'll remind you about the research we did 3 years ago, and then I'll hand over to Susie to talk about the current research project we are undertaking. So 3 years ago, we conducted a survey where, with my colleagues, where we received responses, and some of you probably have helped us, so thank you very much for that. 271 interpreters responded to that survey, which is the largest one in Australia ever, and the second largest one in the world so far. So in that survey, we were able to establish that nearly 80% of interpreters in Australia are affected by traumatic client material encountered in your work. And among these interpreters, some of them might be you here, 70% reported that you had not sought psychological assistance. 40% of you said that you would avoid working in the settings which you know that you might encounter traumatic client content in the future. And of course, we know that that wouldn't be good, particularly for those smaller languages where you already have a small supply of interpreters. And that is why we need to look into this issue further. Before we go on to our current study, just a word of caution, because we don't want to be an alarmist. So, first of all, we just wanted to remind everyone that not everybody who works with traumatized client would develop vicarious trauma. Incident rate is kind of low. These are from research in the psychology and also from the nursing areas. But then if you look at burnout, Judy, thank you very much. You talked about burnout. Burnout, indeed, we have to pay a lot of attention to. So if you look at the last two bullet points, this is from an Israeli clinical psychologist who looked into the interpreting profession, of course, in Israel a few years ago. And she found that the level of burnout is positively correlated with interpreters' time spent in assignments with survivors of torture. And the last point is, interpreters who had a past experience of trauma showed significantly higher levels of burnout compared to those who didn't have it. So that's just something we have to keep in mind. I will skip those. And then I'll hand over to Susie to talk about our current studies.
I'd like to acknowledge the land we stand on, the unceded land of the Wannerong and Wathaurong people of the Kulin Nations, and pay our respects to ancestors and elders past, present, and any current Indigenous interpreters amongst you who do a wonderful work in keeping languages alive. So Miranda and I have been working together at RMIT, me in social work, her in interpreting and translating, in bringing our students together to learn from each other, and they're fabulous sessions. We have some of our students and graduates amongst us who have a session where the social worker plays the social work student, plays the social worker, and the interpreting students play the client and the interpreter, and they get together. And through getting to know wonderful Miranda, who's taught me so much, I have been astonished at what you people have to do without the supports that we as social workers have automatically built into our work. That you are out doing the things we've heard about from our fabulous speakers today, whereas we are working with very similar client groups, the same client groups, and we are, as part of our professional entitlement, given 2 hours of supervision once a week, where we'll talk about our practice, what we've done, we'll talk about the content of what occurred in that session, and we'll talk about how we're feeling and surviving so that we don't get burnt out. And when I understood that interpreters don't have that built into their job, I was really astonished and appalled and felt for you. So in our sessions with interpreters and social work students, we teach our students, social work students, to begin by briefing the interpreter and at the end debriefing them. And it's heartening to hear that everything really we've discovered in this research today has been alerted to today. So we're on the right track. The advantage of the research we've done is that I will publish with Miranda and maybe others about what we're finding in social work journals and maybe other professional journals, so that the non-interpreting professionals can hear the stories that have been told today about what you need. So Miranda and I were interested to know how to improve assistance to prevent vicarious trauma in interpreters. And this is fairly new data that we're presenting. That really, it was 3 weeks ago when we ran the second of 3 focus groups for 50 interpreters. We had 100 people who wanted to and 50 who were able to come. And we've got a 3-stage research project where we have done our focus groups asking what are different cultural views on trauma, what have people done to survive trauma so far, so vicarious trauma, and what suggestions do people have. And so we are now going to design a module or a booklet or dealing with vicarious trauma tool, informing people how trauma and vicarious trauma physiologically affects you and some of the strategies to deal with it. We're going to develop that by February and put it out to people so that you can give feedback saying that's not quite what we want, or could you do something more? And then we'll seek feedback about how that's working and refine it a little bit further. The first question that we asked of our focus groups is, how does your culture affect the way you understand trauma, and how do these ideas prevent or assist you in dealing with trauma? And these are the things that people said. So what we heard back, that many issues are taboo and can't be spoken of. Issues about if someone's being affected by violence from her husband, you're meant to keep it quiet in your culture, so you can't speak about it. That if a child's being sexually abused, it's not to be mentioned, and certainly in some cultures, the father or perpetrator should not be challenged, it should be sidelined. Death, grief, dying, loss are things that are treated in different ways. People who've experienced refugee and migration stories don't want to speak about things and want to keep it quiet. And I'm reminded of doing interviews when I was working up on the Thai-Burma border with people in a community health service in a refugee camp, where I was working with the mother of a child who she felt was being sexually exploited in an organisation, and she couldn't do anything about it. Her husband had died of HIV/AIDS, and I was asking her about what had happened with 2 Korean nurses who were interpreting. And as the interview progressed, I was feeling sadder and sadder for her, and she began crying. And the nurses who were interpreting began laughing. I was glaring at them thinking, this is not the time to laugh. And when the interview finished and I said goodbye to the woman, that we would see her and go and visit her child and do some things about it, I turned to the nurses, trying to be neutral, saying, I don't understand why you were laughing. And they said, we don't understand why you were making her cry. I said, it wasn't me who was making her cry, her stories made her sad. They said, I know, but you shamed her by asking about it so that she had to talk about it. In our culture, in the way we do things here, we do not put people in that difficult situation. And I understood how little I knew then of the cultural interpretations in different countries. And I respected the nurse's way. I said, how do we talk about that? I have to say, over the 6 months I was there, we did negotiate and do things a little bit more differently. But the cultural interpretations of feelings and emotions will determine the way you will interpret in different situations. This is what people are saying. I'm sure that's all very familiar to you. So the impact of trauma on interpreters and the people whom they're interpreting, I thought, as Judy Saba says, the impact on your heart and soul, as this, people say we can feel torn apart from the heart, and a story particularly of a mother interpreting for a child, for a situation, a child like her own, as Judy outlined. So, and it's very difficult when the professionals don't get what's not being said by the words, and what you as interpreters have to speak belies what you can see is really going on, and the professional people aren't picking up that. Very frustrating for you when there's not an outlet for that. Can't the professionals see that this woman is scared? I mean, professionals should be doing their work and you can only say what the person said. And you will have, as I know, insensitive social workers, insensitive psychologists, and sometimes you will be more culturally attuned to what's going on. It's very frustrating. What do you do with that when you finish? The next thing we look at is why interpreters don't seek counselling for these issues. And I think these feedbacks are very sad, and meaning there are things for you to stand on your feet and look at your entitlements. That a lot of people said the professionals really don't value us. We feel that there are very few channels available for interpreters to talk to and with when we're stressed, that the code of ethics expect us to be confidential and keep it completely quiet. And I imagine there's some misunderstanding about the limits of confidentiality, as we explain to our social work students, that there are ways and people to whom you can speak about what's happened, and there are people to whom you must not speak, as Judy was alluding to. That people told stories that if you admit that you've been affected by what you've been going through, it may risk being unemployed. Someone said that I told someone that I couldn't stop crying after my job. They said, okay, you're off our books for the next 6 months. And you think, well, I wasn't wanting that. I was wanting to say, how can I recover from what I've experienced? I don't want to stop working. That for some people and some interpreters from cultures, going to a psychologist means that you're crazy, that there's something wrong with you. Whereas we're teaching in social work, and hopefully for interpreters, that a professional person will seek support and debriefing when you're feeling that you need that. That the idea that you'll be ridiculed for asking for help, and also that you might, if you talk to other interpreters or anyone within a group, that you might be burdening people with what's been going on for you. So the next question is, we asked people about how they handled these issues. So we want interpreters to know they're entitled to ask for help when you want it. That's part of your professionalism. The strategies people came up from other things you've heard today, that a lot of people say, I try to be professional, I try not to feel, that I don't want to feel those things, so I shut them away, that I use it as an educational opportunity to learn more about my job. Don't talk about it. A lot of people refer to their God, their significant spiritual way of understanding things, and using meditation, breathing, exercise, go and have fun, walk the dog. Someone just said, I come home and drink a lot till I can't feel anything. So those defence mechanisms kick in that you want to not feel. So one defence mechanism is to blame people. So if they come around and say that person was sick, they were wrong, they're a terrible person, blaming the victim for their situation. And then the last two, as has been referred to today, people lose the capacity for feeling empathetic and people stop interpreting. And as Miranda was saying, for the newly arrived communities for which there are only a number of interpreters, that's very dangerous for your profession, that you're burnt out, you've lost the capacity to care and you don't want to do the work anymore. That's not good enough for you as a professional person, that you've been left alone to feel those aspects. Other ways, people say, I talk to myself, say, it's not me, it's not mine, different system, different rules, forget about it, put it away. Other people said, I talk and share. That if the trauma's too heavy, I'll find people that I trust, I find people to talk, I talk without divulging, maybe use social media, which actually is a dangerous form of confidentiality, find groups to support each other. Other people say, well, I'm assertive. If it's really, really bad, I will talk to my employer, as Judy suggested that you do. You say, I'm feeling overwhelmed, what can you do to help me recover from each of my counselling sessions? And as Judy said, that debriefing is important to assist interpreters to cope. And I think what you said, that without the opportunity for pre-briefing before you go into a session, debriefing at the end, you're far more likely to experience vicarious trauma from the impact of what you've heard said to you. That we asked what would be helpful. And interestingly, people are saying, we want the opportunity for counselling and debriefing. We want a hotline so that as we go home we can call someone and say, can I just talk anonymously about the situation I had where I'm feeling shaky? So you've got professional people who will respect confidentiality and help you recover immediately, and then you can go on to counselling as well. They ask for the sort of language provider to there's be someone looking out for you, as Judy said, to have someone like the police say, are you okay? And if not, what will you do about it? So we said, what training do you want? And they said, well, we'd like to learn a bit more about trauma, but actually said it's the non-interpreting professionals who need more training. Can you train them how to deal with cultural differences, understanding different dialects, understanding cultural sensitivities, explaining what an interpreter does and the limits of their role, and that interpreters need, non-interpreter professionals need to learn to respect the interpreters. It's so integral to their work. Using the words, not using an interpreter as if it's a machine or just a conversion box, but a person. I'm working with an interpreter. They're part of our team. That agencies should provide training for interpreters' well-being. And one suggestion was that on the claim form, interpreters could give feedback about, I need some extra support or debriefing or support here. And make emotional well-being part of NAATI's revalidation process, that employers take responsibilities for these things. So from Miranda and Sadat and Georgina's research in 2015, found that interpreters use their colleagues and peers half the time, family members almost half the time, friends some of the time, 20%, a fifth go to counselling therapists, but a lot don't do anything. And that's not good enough for your well-being, because we want you to stay strong and clear and keep doing your work well. There are employment assistance programs where you are entitled to. Some people, for the earlier reasons, don't feel that they can ask for that. And as Miranda said, you matter, and you being well cared for, assertive in knowing what your rights and entitlements are very important. Other things and our list of references. So our outcome will be to publish in social work journals and tell your stories so that people are receptive to your needs and support you in the great work you do. Thanks to Miranda, and thanks to the great speakers.